Hello, my name is DeAndrea Bolden, and I want to welcome you, number one, to the Faith and Mental Health Summit, but also to my talk. Listen, and I want you to let me know where you are tuning in from, wherever in the world. Yeah, are you in the U.S.? Are you somewhere else? What state are you in? Just drop a little note in the chat and let me know where you are. And so you're going to see me, excuse me, look up a little bit because I have a screen. Unfortunately, I tried to have my slides on here with me and it didn't work. And this is the fourth time going over this talk. And so I just want to make sure that I get it done and get it right this time. And so I'm going to be talking about faith and mental health, the supportive role of the church. So, a little introduction as to why this conversation matters. Opening scripture, Matthew 11 and 28 in the NIV, it says, "Come to me, all you who are wearied and burdened, and I will give you rest." So, let's frame the issue. Mental illness affects one in five adults in the US every single year. This is important to understand because this statistics hold true in and out of the church, regardless of your social economic status, your religious background, your marital status, gender, whatever. That stat holds true. Churches are often first responders for those in some type of mental health crisis, and so there's statistics that show this is true whether a person is a believer or not, that they are most prone to go to a church when they're experiencing mental health crisis. So we're going to explore how faith communities can be proactive partners in mental health care. Excuse me. So understanding mental health in a faith context, defining mental health. We would do a quick definition of defining mental health as emotional and psychological and social well-being. I like to say, is it well with your soul? And when we look at one of my favorite scriptures, 3 John 1 and 2, where it says, "Beloved, I wish above all thou may prosper and be in health, even as your soul prospers." The word soul there is suke. The word suke is related to the word psyche. And from the word psyche, that is connected to the word psychology. And so psychology is the study of emotions, thinking, and behavior. And so seeing that the soul is mind, will, and emotions, I think we can kind of see that psychology in a nutshell is kind of studying the soul of man. You know, why do you think the way you do? Why do you behave the way you do? Why do you feel the way you do? Let's discuss those things. So that's kind of what the world of psychology is about. And so I want to talk about common misconceptions in faith communities. One is that mental illness is a result of sin or weak faith, not trusting God enough, not praying enough, not reading scripture enough. We have to stop making people feel like they have done something to cause illness. Mental health is health, mental illness is illness. And so when we realize that, we will stop trying to come up with reasons and blame people for why they are dealing with some of the things they are dealing with. Prayer alone as a sufficient remedy. Prayer does not replace therapy. Therapy does not replace prayer. They are not in competition with each other, but they are complementary to each other. You can have a Bible and a therapist. You can have Christ and a counselor. You can be, full of God's spirit and still get professional mental health. And so two things can be true. And I find that a lot of things that we argue about in society, if we stop thinking that everything is either or and that sometimes it can be two things true at the same time, we can resolve a lot of things and handle things better. So let's look at a theological perspective. When we look at biblical figures like Elijah and David, even Jesus in the garden, and when Jesus wept, we can see those deep emotions. We can see distress. We can see people in situations where they tore their clothing when they got bad news, and different things like that. And so it's important to realize that even from a biblical perspective, people weren't always happy, people weren't always doing the best, things weren't always going great for them. And so it's important for us to realize that Experiencing emotional issues and dealing with mental health challenges is universal. Mental health is universal. We're all going to go through things. Just because a person is going to therapy doesn't mean that they'll be diagnosed with a mental health disorder. People can have a subclinical presentation, or meaning they may just have things they need to work through. They may not have an actual mental illness. That's okay. But even those that may have a mental illness, that's the purpose of professional mental health care. So the importance of holistic healing. We're talking about body, soul, and spirit. Thessalonians 5:23 says, I pray that the Lord will sanctify you wholly, body, soul, and spirit. The world says mind, body, and soul. It's important to understand that you're a spirit in a body that possesses a soul. Your body is your house, your soul is your mind, your will, and your emotions. Your spirit is the real you. It's the innermost, your innermost being. It's the part of us that when say they that worship him must worship in spirit and in truth. That's referring to our spirit. We worship God out of our spirit. And so it's important to understand that the whole person has to be considered. If a person gets a bad health diagnosis, they may start experiencing a depressed mood or even anxiety. And so, what happens to us and our experiences, different things we go through, can impact our mental health, whether for the better or not for the better. Um, let's talk about the church's role in mental health. One thing the church should be doing when it comes to mental health is creating safe spaces. This is a very, very important topic for me because I have lost track of the number of people that have reached out to me that have left or are leaving the church because of how they were mishandled and mistreated. We should not be using the pulpit to berate and belittle people and, call people bipolar and schizophrenic from the pulpit, knowing that by things like bipolar and schizophrenia are chronic and serious mental illnesses that can be progressive and that can be lifelong issues for people. And so we should not cause anyone to feel bad or be embarrassed or feel ashamed coming to the church. Why in the world would someone come to the church and leave more wounded? And so we want to encourage open discussions about mental health so that we can destigmatize it as we destigmatize normal mental health, and normalize conversations about mental health. We can get rid of some of those misconceptions and some of the stigma, believing that everything about mental illness and mental health issues is demonic. Everything is a demon. All these things that we believe that aren't necessarily true. And so we want to reduce stigma by sharing testimonies and sermons that address mental health. We can also promote understanding and compassion over judgment. The same compassion that we give people when they're in the hospital with a physiological health condition is the same compassion we should give someone if they're dealing with mental health challenges. One thing we have to understand is because of the stigma around mental health in and out of the church, it causes people to be embarrassed many times and shamed. And a lot of times people are already questioning, what's wrong with me and all these things. And we don't want to make people feel worse. We have to make sure we're giving people support. A lot of people that are dealing with mental health issues sometimes do not have strong support systems. And sometimes they will self-isolate when they're going through different mental health issues. And so we have to make sure that we are not harming people and we are not offending people or belittling people or treating people as intellectually inferior or treating adults like they are children because they're dealing with mental health issues as if they can't do anything on their own. And so we want to that's where education and learning and understanding comes in so that we know how to treat people properly. And I think the one thing is the golden rule: treat people how you want to be treated. I don't think that's very hard. Um, so let's continue to talk about the church's role in mental health support. So let's talk about integrating faith with professional care. Um, this is a biggie because I want to take a minute and explain some of the different types of mental health professionals. And so I want to start with psychiatrists. A psychiatrist is a board certified medical doctor that is able to treat and diagnose, treat, mental health disorders, including the use of medication. You also have other providers, such as physician's assistants and nurse practitioners, that may specialize in psychiatric care, but they will work with a physician, but they can also prescribe medication. Then you have individuals such as psychologists. They typically have a 4-year degree in a PhD or a PsyD in something like clinical psychology or something like that. And with the exception of 5 states, they are not allowed to prescribe medication. There are 5 states that allow PhD level psychologists to do postdoctoral training to be able to prescribe medicine, but that's only in 5 states. Outside of that, you have your state licensed therapists that tend to have a master's degree, your clinical licensed social workers that will have a master's degree, substance abuse counselors. I did that for several years. Um, you have qualified sometimes mental health professionals. They will, it's a state credential, but the qualifications for it vary, and they're limited in what they can do. You may also have peer support specialists and things like that, but again, they're not necessarily providing care. And so only those that have a state license, typically a master's degree on up, are able to really diagnose and treat. Um, and outside, as far as those that don't do, that cannot prescribe medication, they will focus on things such as EMDR, cognitive behavioral therapy, dialectical behavioral therapy, different forms of talk therapy, and other things to help people that are dealing with different mental health challenges. And so understanding who the professionals are is important, because in the church we have a lot of certified Christian counselors, and a certified Christian counselor is not necessarily licensed. If they're only certified, they cannot provide professional mental health services. They have more of the limitations and the range of a pastoral counselor. Clergy by law can counsel on spiritual matters, but they cannot give counsel, they cannot diagnose, they cannot treat, and they cannot uh, deal with things that are beyond their scope and their range. So if a person is only a certified Christian counselor, and we need them, they have their role in the church. They just can't provide professional care. So when I say integrating faith with professional care, these would be licensed and board certified providers. There are providers out there that will offer faith integrated care. And so they would have to ask your permission to include things such as scripture, to include things such as prayer. And so these are tools that some professionals will offer when it comes to integrated faith practices. Now, because Christian counseling has become a marketing word and a buzzword and a marketing tool, everyone that is presenting themselves as a Christian counselor is not a Christian. And so I suggest to people to find Christian counseling agencies, connect with clinicians in your network that are Christians, even possibly clinicians in your congregation. Now, people may not be comfortable going to clinicians in your congregation because of the proximity, and different things like that, knowing them and the relationship they may have. So let's be sensitive to realize that people may not necessarily want to get care within their church. However, if a church decides they want to set up a mental health ministry, that clinician may be the one to kind of lead, direct, and spearhead it. But it's important to have referrals of people that are outside the church so that people feel more comfortable. One thing about it is a lot of pastors have made the mistake of, providing pastoral counseling, then getting up on a Sunday morning and telling the people's business, or sharing it. No one wants their lowest moments, their most embarrassing things, or their private matters put out there, like it's on a news channel. That's very disrespectful. It's unethical. I think it's criminal. And And if people leave churches behind that, then it's well deserved. That's not how you treat people, and that's not how you care for people, and that's not how you protect people. So this is why we talk about professional care, so that people are going to individuals that understand things such as privacy and HIPAA. It's also important to understand when people go to professional mental health providers, these are not your friends. They should not be building a friendship with you. They should not be trying to date you or have a romantic relationship with you. They should not have access to the ins and outs of your personal life to where they're controlling your finances or interfering with a lot of aspects of your life. I've seen even in the world of counseling where there are unethical counselors that really need their license shredded because they are not following the ethical guidelines. So it's important that you find therapists that are ethical. If the church is going to provide things such as mental health coaching or peer support or Christian counseling and pastoral counseling, it's important that the church has a code of ethical standards, just like there should be a code of ethical standards in the secular world, or just in the professional community, should I say, because there are a lot of professionals that are believers, that are Christians. And so the church should be providing spiritual support alongside professional treatment. And so what this means is that while people are getting professional treatment, the church should be a place of support, building people up spiritually, building up their spiritual man, building up their most holy faith, as Scripture would say, providing that support, maybe even providing that pastoral counsel for spiritual matters while they're getting the professional treatment. Equipping church leaders and members. This is a biggie, because if people regardless of their faith or regardless of their beliefs are going to the church first in a crisis, the church needs to be trained. Pastors need to be trained, leaders need to be trained. Any person in the church that does a lot of interacting with people needs to be trained. So there's things such as mental health first aid courses, which just teaches people how to handle in a mental health, how to recognize and respond to mental health crises. Training courses, organizations like Faith and Mental Health provide training courses that allow and help excuse me, equip leaders in churches and ministries and organizations in the world of faith-based mental health. We also order workshops to help pastors and ministries implement mental health ministries, to equip and to train to people to recognize and be able to handle mental health crises, to be able to recognize the signs of mental health issues, to know when and where to refer out, to build those directories. It says that right there, creating directories of local mental health services. And so Faith and Mental Health has a directory. Our directory does not just include professional mental health clinicians. We also want to include health providers because, we want to make sure that we're taking care of body, soul, and spirit, physical therapists, because, exercising is good for your mental health, dietitians, because eating healthy can have a great impact on your mental health. The way we treat our body, can affect our mental health. And so we want to make sure we're taking care of ourselves. Nothing wrong with, I'm a proponent of people going to therapy, excuse me, but sometimes we also need to take better care of ourselves by exercising, eating healthy, working on our sleep hygiene, just different things like that that can help us be at max capacity. Um, Developing support groups within the church. And so with this, I'm not talking about necessarily a continuing running support group. That can be kind of laborious sometimes. I'm talking more of, there are some issues that are very prominent in churches. One of them is grief, another one is bitterness and unforgiveness. Now, we know what the scriptures say about unforgiveness and bitterness. However, science has once again caught up with the Bible, and they are teaching on the importance of forgiveness therapy, because they have found that some people that were experiencing issues with their physical and mental health, started doing better and getting better and having a better prognosis when they forgave and got rid of all those negative emotions, all those negative feelings, and released all that stuff. They started to see progress in their physical and mental health. Um, so having support groups is more like pulling together sessions on unforgiveness and then bringing in a clinician that may be because a lot of people that are dealing with unforgiveness, it's rooted in trauma. And so bringing in a clinician that specializes in trauma to come and run a session so that they can pour into your leaders and your congregation, answer questions, and even help some of the people possibly find professional services. Another one is grief. Everyone grieving is not grieving someone that has died. You can grieve someone that is living. You can grieve a missed opportunity. You can grieve a foreclosed home. You can grieve a failed business. You can grieve a lost job. You can grieve the mother or father that you never had. They're alive, but you never had the relationship that you should have had. You may grieve a loved one that's incarcerated. And so those type of supports are needed because a lot of people are dealing with feelings of grief and heaviness, and they don't really know what to do. So pulling together sessions like that, bringing in clinicians and teaching on mental health through a faith-based lens can be very powerful because it only helps it only helps leaders and churches best serve the people that they're called to serve. If people are a reflection of their organization, wouldn't you want people to be at their best? So if people are at their best, your organization can run at its best. The work of a pastor isn't as hard when people are emotionally and psychologically and mentally well. And so a lot of times people will experience what we call stagnation or lack of spiritual growth, or they just can't seem to get with the program because sometimes people are hindered by unresolved childhood trauma, unresolved wounds. They're dealing with all type of fear and anxiety and depression, all type of things that need to be dealt with so that then they can be in a place to take better care of themselves spiritually, to be more connected and involved in their faith community. And so if you want your leaders, or if you're a pastor, if you want to show up at your best, if you want your leaders to show up at their best, prioritize mental health. If we want to see marriages and families healthier, prioritize mental health. If people get better, they can be better. And if people can be better, they can be better spouses, they can be better parents, they can be better leaders, they can be better sons and daughters, they can be better pastors. And so you can't expect anyone to be at their best if they're not at their best because mental health is your health. And so if a person is not mentally healthy, we can't expect to see the best representation of them. And if they are leadership in the church, we can't expect them to be the best representation of Jesus Christ. And so it's important that we recognize that prioritizing mental health is prioritizing the health of your organization. Equipping church leaders and members. You can host mental health awareness events. The Mental Health Awareness Month is May. That's why we host this conference in the month of May. Partner with local outreach organizations for different programs. So Faith and Mental Health, although we are our headquarters and we function out of Kalamazoo, Michigan, we can work with organizations anywhere in the country. We can work virtually and even work with organizations in other countries. And so we offer virtual and in-person training to different organizations. These are some of the local mental health resources. Sorry for Kalamazoo. I think I'll put the handout in there. I keep forgetting you guys can't see the the PowerPoint. I also shared some national mental health resources. I also shared in the digital swag bag, go to media, go to the digital swag bag. I shared option for respite care. I think sometimes we forget caregivers and how burnt out they are. Those that may be dealing with children that are on the spectrum, and sometimes they can get burnt out. It can be a lot. People that may be caring for elderly loved ones or people that may have cognitive impairments. And so there are respite care options that sometimes people are not aware of, where either you can take your loved one to a respite care location, or they sometimes will come into your home to give you a break so that you can, to have a couple hours to yourself and work on your self-care or go to an appointment or go to an event or whatever it is. And so I think it's important that people realize that caregivers have to care for themselves. You can't be a great caregiver if you're burnt out and you have nothing left to give. And so that's how people can start become very a little callous and snappy and harsh because they're tired. And so we have to be compassionate and understanding that if somebody is caring for somebody 24/7, 365, they need a break and they need to be poured into and they need to be able to have support. And so the church needs to even be supporting those that are caring for others. So we want to encourage the church to be a beacon of hope and healing. We don't want to offend people. We want people to feel welcome in the church. We don't want to belittle and minimize people and hurt people. We want to understand and have compassion and understanding. We want to give people just as much compassion when they are dealing with health in their body. The same thing with mental health. If we give people the support and love they want, sometimes people would, number one, be more prone to being compliant with things such as taking their medication. They may be more compliant with getting treatment, and they may be more open to getting help. Um, I think sometimes, especially in the church, not only have we stigmatized mental health, but we've stigmatized medication. And if anyone has ever seen someone walking around, talking to themselves, people that have lost their homes and their jobs due to mental health issues, and sometimes addiction can be a part of it. And sometimes people have co-occurring disorders or dual diagnosis where they may be dealing with a substance use issue and a mental health disorder. And so we have to have understanding and realizing if we don't want to see people in that state, and I'm giving you like extreme examples, we shouldn't be okay with people living and suffering like that. That's suffering. And so if medication allows a person to get their life back, to be able to hold down a job, to be able to be connected to their children, to be able to keep a roof over their head and live a productive life, we should not be fighting that. I've also had to warn pastors about telling people to stop taking their medication. If your pastor is not a medical doctor, they do not have the authority to tell you to stop taking your medication. If you're a leader in a church or you're a leader over people and people are coming to you with mental health issues and they're struggling in the area of being compliant with their medication, encourage them to go back to their provider to see about having their doses adjusted or see about even trying a different medication. But I don't think sometimes we understand that people that are working in the field of mental health, these are people that have dedicated years of their life to academia and training. Medical doctors have extensive training. Psychiatric nurses and physician's assistants have extensive training, along with psychologists and clinical social workers and therapists. So don't think these people are just out there winging it. They have the expertise, the knowledge, and the information. And that's why we want to have these type of events so we can have these conversations, because a lot of times people simply don't understand. And what we don't understand, a lot of times in the church, we're very quick to dismiss, we're quick to demonize. And I do believe in deliverance. I believe in the power of God, but everything concerning mental illness is not demonic, nor is it always spiritual. And so understanding that it's not always spiritual should help us to have some understanding, because if it was only spiritual, doctors wouldn't be able to treat it. Same thing with physical health. Physical health, they're able to treat it because there's a biological aspect to it. And so mental health issues can have environmental, biological, all type of factors involved as to why mental health issues begin to develop in people. There's not, just some one reason as to why. And so we don't want to overgeneralize and oversimplify mental illness by saying demon, 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 demon. And so even though I believe in the power of prayer, I believe in ministry and laboring with people on the altar, we have to have a response for people after they get off the altar. We have to have things in place to be able to help the broken people after they get off the altar. What is our response? What help and tools and resources do we have in place for these people? What support and what love and what measures do we have to help people get to their best mentally? And so I think it's best, and it's good to understand that, that's why there's mental health professionals. And so if that's not your area of expertise, that's why it's so easy and so wonderful to you to just refer those people out to someone that has the training, the education, the authority, and the compassion and the love and the burden to help those that are struggling with mental health issues. And so we want to just make sure that we're a place of compassion and understanding, that we have those referrals and resources together, that we can recognize and acknowledge when people are dealing with mental health issues and mental health crises, and know how to respond and get them to the professionals that can help them. So next steps, implement training programs for leaders, establish partnerships with mental health organizations like Faith and Mental Health. Hey, but there's a lot of faith-based organizations that are out there doing an excellent and mighty work, but we would love to work with you. Feel free to reach out. Foster an environment where mental health is openly discussed and supported. When pastors talk openly about mental health, when pastors say things like they have a therapist, and I believe that all pastors should have a therapist, because pastors go through so many more things that a lot of people don't recognize. They grieve members that lose. I don't think sometimes people understand that pastors pay people's rent, keep their lights on, giving folks cars, putting groceries in their houses. And these same people turn around and dog them out. These same people turn around and walk away from the ministry, never give a reason why, never say thank you or anything. And it crushes a lot of pastors. It makes them feel like they're failures and that they failed and that they've done something wrong. If their ministry isn't growing, they feel like, God is not pleased. And so pastors are dealing with a lot of struggles and internal struggles and sometimes self-rejection, and not loving and caring for themselves the way they should. Pastors can feel very isolated and guarded and feel like, I can't show that weakness because people won't respect me as a leader. I can't show that weakness because people won't follow me. But I think it's important that although pastors don't have to bleed on and share their issues with their congregation, when pastors can openly admit, like, hey, I go to therapy to help me so that I stay encouraged, so that I stay built up, so that I can keep showing up and be the best version of myself to best serve you all, they'll realize, well, wait a minute, maybe I should consider going to therapy for some of my issues as well too. And although they may not be a pastor, they may need to show up for their families. And so pastors have families, they may have spouses and children. Sometimes the entire pastor's household needs to go into therapy to work through some of those dynamics, where sometimes children and spouses may feel like they are second fiddle, to ministry and different things, just, different things. Sometimes pastors have to have a better balance in making sure that they're giving their family the right amount of time that they need. And so sometimes therapy can help you recognize those things and see those things so you can get the help that you need. And so, but yeah, so, and I want to I also want to say this, I can't remember if I said this earlier, but everybody that goes to therapy is not necessarily mentally ill. Every time you go to the doctor, it doesn't mean you're sick. Um, I do think it's important that, again, that people go to therapists that are a good fit for them. If you're experiencing hallucinations and delusions, you don't go to a licensed marriage and family therapist. You'd be better off with a psychiatrist or at least a psychologist, um, to try to get some help. If you're dealing with a lot of trauma, you're not going to go to someone, again, that specializes in marriage and family. You're not going to necessarily go to a psychiatrist because you and your spouse are trying to get some understanding about finances. That may be better for a licensed marriage and family and marriage therapist. And so we have to understand there's different type of clinicians, just like there's different type of healthcare providers. Counseling is not just a box you check off. You should be reaching your goals and getting better. And just like with physical health, I tell people, if somebody's not a good fit for you, find someone else. If you're not reaching your goals and you're not getting better, find someone that's best suited. Find someone that has the expertise for the issues that you have. If all those things are important. And so as pastors normalize the conversation, congregants will normalize the conversation and getting help, and then that will spill into their families and their communities and different things like that. So we want to make sure we're supporting and loving on people. So Faith and Mental Health offers virtual and in-person workshops tailored for groups seeking education and support around mental health topics. We also offer an 8-week course designed to equip clergy and lay members with knowledge and skills needed to understand, recognize, and respond to mental health challenges, and things that are needed for people that want to put in and implement a mental health ministry necessarily in their church. I don't think I shared any of my academic background. Sorry. I worked as a substance abuse counselor for several years. I have a bachelor's in psychology and chemistry. I have a master's in counseling, a master's in medical sciences, and I have a AI developer certification. And I'm trying to, yeah, kind of loving tech now too. But, uh, but yeah, so it's important to understand that, I do believe that a lot of pastors before pastoring, they should get mental health training. because you need to be able to recognize when people are having mental health issues. You should be able to recognize the mental health crisis. You should know what to do. You should have those referrals and those internal things together. Pastoral counseling should be all set up and ready to go to help support people with spiritual matters. But beyond that, I put this course together so I can take all the education I have, the knowledge, and give people the information that is most necessary and needed in an 8-week course to help give them some of the equipping and training they need to be able to best serve those that they serve and to be able to protect and help those that may be dealing with mental health issues. Um, and then the last thing, I'm offering June 18th, I believe, at 7 p.m. Eastern Standard Time, a DSM-5 and the church. I'm offering that online webinar. And so this is a quick little webinar designed to help people in ministry, whether you're, a pastor or a leader, whatever, or even a lay member, to learn more about mental health and in the church, and to be able to recognize signs of mental health issues, to be able to recognize the mental health crises, and to have some recourse in knowing what to do. And so I'm offering that 30% off for all conference attendees. The use the code, sorry, Summit, the word Summit, SUMMIT, all capital letters. This is also in the digital swag bag. If you go to media, I have that in there. I also have information about our church workshops. If you're interested in bringing myself, the team, in virtually or in person for a mental health workshop, feel free to reach out. If you have questions, comments, or concerns, reach out to me. Reach out if you want to reach out to me on a more of a ministry side, then it's deandreabolden.com. But if you want to reach out as far as faith and mental health, it's faithandmentalhealth.net. And so we have a lot of work to do. I'm excited about this. I'm excited about where this is headed and where this is going. I want to thank you again for tuning into my talk today. I hope something I said was beneficial. Please, chime in, let me know where you're tuning in from. Talk to me, say something to me, interact with me, let me know that you're listening. God bless you all, and bye-bye.